I welcome you to the webinar on what age does really to our blood pressure. And you may know me mostly as the admin of the Facebook group Blood Pressure Help, where we have just achieved over 22,000 members. But also, I'm involved in development of various software to support people with high blood pressure. My Artery app has now enjoyed over 60,000 downloads. But anyway, I will have another webinar on that. Now, when perhaps we should start talking about what age really does to our blood pressure from another topic, from what people think aging does to our blood pressure. So when we talk about aging and blood pressure, most people have a very simple mental model in mind. They imagine that as the years pass, the numbers on the blood pressure monitor slowly increase, and that this increase is simply a natural and unavoidable part of getting older. Now, that idea contains some truth, but it is incomplete in a way that can lead to very serious misunderstandings. Because this idea focuses only on the direction of change, which is up. But it ignores the most important aspect, which is how the structure of blood pressure changes over time. And what happens with age with our blood pressure is that actually it's not only the level of blood pressure that changes. It not only the increase in the simple numbers. What changes more fundamentally is the pattern, meaning the way the numbers behave and how the top and bottom readings relate to each other, and also how these numbers respond to various situations, such as rest, stress, or sleep. And this is what I'm going to focus on today. So once you begin to understand this pattern, many things that previously felt inconsistent, confusing, or even alarming start to be more predictable and easier to interpret. I want to start with a situation that I encounter very frequently in these blood pressure assessment sessions where I work with people and help them understand their blood pressure in detail. A person in her early 50s, a woman in her early 50s begins measuring her blood pressure at home. And for many years, her readings have been stable, typically around 120 systolic. Systolic refers to the top number. The pressure measured, that is the pressure measured at the moment when the heart contracts and pushes blood into the arteries. So then gradually and without any dramatic change, in how this woman feels, the numbers begin to shift. And she starts seeing readings like 135, then 140, sometimes 145. At the same time, the diastolic blood pressure, which is the bottom number, and it represents the pressure when the heart is resting between the beats. It remains miraculously stable, often around 75 or 80. And this woman, she feels well. She is active, actually. She does not experience any symptoms. And this creates a situation where the numbers are changing, but her body is not providing strong signal that something is wrong. This situation is extremely common, and it is precisely this situation that where understanding the pattern behind the numbers becomes essential. So what age really changes inside the body? And basically, there are really only two things. And to understand this pattern, we need to look at what is happening inside the arteries. What are the arteries? Arteries are the blood vessels that carry blood from the heart to the rest of the body. When we are younger, the walls of the arteries contain a high proportion of elastic fibers, which allow the vessels to stretch and expand when blood is pushing through them. This stretching is not just a passive movement, it has an important function. It allows the arteries to absorb a part of the force generated by the heartbeat. You can think of it as a built-in buffering system that reduces the intensity of the pressure wave. So each time when the heart beats, it creates a pressure wave, which is a surge of force moving through the blood vessels. In younger arteries, this wave is softened because the vessel walls expand slightly and then return to their original shape. But as we age, the composition of the arterial walls changes. The elastic components are gradually reduced and the vessels become more stiff, meaning that they are less able to stretch. This process is called arterial stiffness, which simply means that the arteries have lost some of their flexibility. And here, I mean on this slide, they are less elastic, so they lose elasticity. But at the same time, there is another process that goes on with arteries as we age. And this is a process, it's a structural process also, and it is called calcification. Calcification means that the small deposits of calcium, the same mineral that makes our bones hard, begin to accumulate in the walls of the arteries. These calcium deposits act like tiny rigid plates within the vessel wall. They reduce flexibility further and make the arteries behave less like elastic tubes and more like rigid pipes. Now, when arterial stiffness and calcification develop further, the arteries lose both their ability to expand and their ability to absorb pressure. As a result, the pressure wave generated by each heartbeat travels more directly and more forcefully through the system, and part of that wave reflects back toward the heart, increasing the measured blood pressure. I want to tell you a bit about this structural change and what effect it has on the systolic blood pressure. And you can see here that I have described it just with one arrow up. That means raise. So the systolic blood pressure, to remind you, represents the force inside the arteries at the exact moment when the heart contracts and pushes blood forward. Now, if the arteries are flexible, part of this force is absorbed by the expansion of the vessel walls. If the arteries are stiff and partially calcified, much less of this force is absorbed and more is transmitted directly. This leads to a higher measured pressure during each heartbeat. This is why many people observe a gradual increase in their systolic readings over time, even in the absence of clear changes in their daily habits. In my assessment sessions, people often express confusion about it. They say that they feel calm, that they have not changed their healthy lifestyle routines, and they really do not understand why the numbers are rising. Now, why exactly are they rising? Basically, this reflects what this reflects is the assumption that blood pressure is driven only by behavioral factors, such as stress or diet. But what we are describing here is a structural process, meaning that physical properties of the arteries themselves are changing, and that this change has direct impact on the measured blood pressure. Now, let's go to the diastolic blood pressure. Here I have a bit better news for you. What happens at the same time as we age is that diastolic pressure, that is the bottom number, follows a totally different pattern. The diastolic pressure represents the force in the arteries during the phase when the heart is relaxed between beats and is filling with blood. So in younger arteries, the vessel walls stretch during the heartbeat and then recoil, meaning that they contract back during the resting phase. This recoil helps pressure between the beats. As arteries become stiff and calcified, this recoil becomes weaker. The vessels do not maintain pressure as effectively during the resting phase. And as a result, the diastolic pressure often stops increasing and may actually begin to decrease slightly. So these are, in fact, some good news for us. I am 58, so for me, it's definitely very good news. What happens is that this creates a situation in which the top and bottom number no longer move together, and instead they begin to diverge. When these changes are combined, they produce a very characteristic pattern. And I have presented it here on this slide. It is very important. It is perhaps the central part of this presentation. And that is the aging blood pressure pattern. So what happens is that the systolic blood pressure as we age increases, the diastolic blood pressure remains stable or decreases, and the difference between these two numbers becomes larger. Well, may become larger. Many people focus on this bottom diastolic, on the bottom reading, on the diastolic blood pressure. And they feel reassured by that. But this overlooks the significance of the increasing difference between the numbers. So the difference between the systolic and the systolic and diastolic values is called pulse pressure. Pulse pressure reflects how effectively the arteries are able to absorb and redistribute the force generated by the heart. When a person is younger and the arteries are elastic, pulse pressure is usually around 40. This means that this basically means that the arteries are elastic. And when the arteries are elastic, so the number 40 means elastic. It means that the arteries are able to stretch and that they actually can provide a cushion for the pressure wave, reducing the difference between the peak pressure and the resting pressure. And arterial stiffness increases and calcification progresses with age. So the arteries lose this buffering capacity. The systolic pressure rises because the force of the heartbeat is no longer absorbed. At the same time, diastolic pressure does not rise in the same way because arteries do not maintain pressure effectively between the heartbeats. This combination leads to a widening of the pulse pressure, often to values of 60, 70 or higher. So for example, 120 minus 80 is 40, but 120 over 60, here we have the pulse pressure of 60, the difference between these two numbers. And it's quite alarming, really. Because what happens is that this widening, it reflects a more direct transmission of force through the vascular system. And the blood flow becomes more pulsatile, meaning that it moves in stronger surges rather than a smooth or even flow. Over time, this increased pulsatility places additional mechanical stress on the vessel walls and contributes to the gradual wear of the vascular system. And You see, it is very common for people to conclude that when you age, when you're old, your blood pressure rises. It's like it's okay for your age. It's normal for your age, they say. But this is the problem. It's because it's not right. Because common is not harmless. And my key message is that high blood pressure among elder people is more spread, yes, but it doesn't make this high blood pressure normal because this pattern is, of course, very frequently observed in people who are of age. But it does not mean that it is normal and that it is not a cause for concern, because it is very important to distinguish between what is normal and what is harmless. Elevated systolic blood pressure and increased pulse pressure remain associated with higher risk of adverse cardiovascular events, such as a stroke, which is the disruption of the blood flow to the brain, and heart attack, which is the blockage of blood flow to the heart muscle. I worked with a woman in her late 50s, and she had consistent readings over 145 over 78. She had been told that this level was acceptable for her age, so she had not taken any action. When we reviewed her measurements over time, we observed a gradual increase in her systolic pressure. We also calculated her pulse pressure and found that it also had increased compared to earlier measurements. In addition, we examined her daily routine and found out that after nights of reduced sleep quality, her readings were consistently higher. So by bringing together this structural understanding of arterial stiffness and the daily influences such as sleep, we were able to explain the patterns that this woman was observing. And now she is taking appropriate medications and maintains a healthy lifestyle that I helped her formulate. When people measure their blood pressure at home, they often notice that their readings are not constant. There is, of course, a variation from one day to another. Then there are differences between morning and evening readings because blood pressure follows a daily tempo. There are increases after stressful situations, even when those situations are not perceived as extreme. There are also increases after poor or interrupted sleep because the body remains in a more activated state after when we did not sleep enough or when we did not sleep well. But with aging, and especially with increasing arterial stiffness and calcification, these variations can become more pronounced. You should consider your own readings and whether you see changes in the top number, the bottom number, the gap, and the overall pattern that you have to analyze and identify. And I can help you do it. Aging changes the pattern of blood pressure. The systolic blood pressure rises, the diastolic blood pressure behaves differently, almost never rises, but either stays stable or actually decreases somewhat. And as we said, the pulse pressure widens. Understanding this pattern allows you to interpret your readings more clearly. And if you want to understand your own individual pattern, that is what I focus on in my blood pressure assessment sessions that I'm offering.